Kangaroo mother care. This is a method of caring for the low birth weight and the preterm infants involving skin to skin contact, exclusive breastfeeding, and the early discharge with the continued follow up. It promotes the thermal regulation, breastfeeding, and bonding between the mother and baby. For the components of KMC, skin to skin contact, infant is placed upright against the bare chest of the mother or the caregiver. Provides a warmth, stabilizes vital signs, and improves the bonding. Exclusive breastfeeding encouraged unless contraindicated. Expressed breast milk can be used if the infant cannot suckle. Early discharge and the follow-up. Mother and infant can be discharged once they are stable and breastfeeding is established. Regular follow-up is essential for monitoring the growth and development. And the eligibility for KMC, one is a suitable infant, low birth weight or the very low birth weight, neonates, preterm infants who are clinically stable. Exclusion: critically ill infants requiring the intensive care until stabilized. Conditions requiring the immediate medical intervention. Steps for the KMC. First one is a preparation. Ensure the mother or the caregiver is comfortable and trained in the technique. Positioning: baby is placed in an upright position on the caregiver's bare chest. It is turned to one side with the neck slightly extended. Baby's hips are flexed and the arms are close to the chest. Secure the baby with a cloth or the binder to allow prolonged skin to skin contact. Duration: ideally continuous, but at least 1 to 2 hours per session if intermittent. Can be performed as long as the baby needs warmth on the support. Breastfeeding: this is initiated while in the KMC position is possible. Benefits of KMC for the infant: maintains the thermoregulation, reduces the risk of infection, promotes the weight gain and the growth, improves the breastfeeding rate and the duration, reduces the hospital stay and the mortality, enhances the neurodevelopmental outcome. For the mother, strengthens the maternal infant bonding, boosts the confidence in caring for the baby, enhances the milk production. And the last one is the monitoring during the KMC. Regularly check the baby's temperature, breathing and color, feeding and the weight gain. Ensure the mother is comfortable and not fatigued. Indications like low birth weight, lesser than 2.5 kg, preterm neonates greater than 32 weeks who are clinically stable, stable neonates recovering from the illness like sepsis. Contraindications like critically ill neonates requiring the intensive monitoring or mechanical ventilation, severe congenital malformation, babies with unstable clinical condition. Challenges: requires the training and the motivation for the caregivers, limited implementation in resource constrained settings, cultural and the social acceptance varied in some regions.